also really promising today is something I know Northwell that you work for is going to be having, that a COVID-19 treatment now available at our area hospitals as soon as today. So this one coming from Regeneron, which we heard a lot about when the president was obviously hospitalized with COVID. But now Regeneron has been given the green light on this specific antibody cocktail. And the cocktail has 2 powerful antibodies that have shown promise in early studies in keeping infection in check, reducing medical visits in patients who get the drug early in the course of their disease. And there's that similar treatment we've been talking to you about that was given emergency approval, that one by Eli Lilly. So I guess let's start with, how would you make sure that someone gets this if they are to need it?
Sure. So first thing is, we need to make sure that clinicians, healthcare providers, and patients are aware that there is treatment available for early, mild to moderate disease of COVID-19. But the key word is early. So we really do need to get people tested. We need to get the results back. And it does require a referral from a clinician to these specific infusion centers that will be set up.
So this is something I have to go to a specific place and really get an IV, right? So this isn't something you can give me a prescription, I'm going to CVS and getting an antibody cocktail.
No, absolutely not, because we want to do 2 things. We want to monitor you before. We want to make sure you fulfill the eligibility criteria for the medication. And we want to monitor you after you get the infusion, just to make sure there's no side effects and any complications of the treatment. The other thing is, these are very specific criteria, so we have to make sure that people who are eligible get access to it right away as soon as possible.
Because there's a certain period of time in which this has to be done, correct?
Correct. And the reason is because the ideal timing of getting monoclonal antibody treatment is going to be before we develop a lot of antibodies to it, so that our immune system can be appropriately responding. So we really want to get folks tested within the first few days of symptoms developing, and then right to that eligibility team who's going to screen you, make sure you're appropriate and you're safe, and get you started on the infusion.
Now, this is not FDA approved. This is an emergency use authorization. So is this kind of like a bridge, really getting us to where we need to be before the vaccine is widely available?
It is, and I think that it's a promising bridge, because while we have talked a lot about vaccinations and inoculation availability, this may help us get those patients who do have COVID-19 and are at risk for severe disease, to get them to be safe, stay out of the hospital, and hopefully recover much, much faster than previous times.